Health will continue to provide case management services for individuals other than intellectually disabled. The offices downstairs will handle the intellectually disabled, and Siouxland Mental Health will continue to handle the other populations, the brain injury, developmental disabilities, child mental health waiver. So we need to do the contract with them to reflect that. The contract that was in your in your packet had some date errors in there that I had to change, and I have for the contract for signature, but it was just dates and length of time for the audit to be turned into Woodbury County. So we're good to go with the contract that is for your consideration this morning for case management services.
I move on the contract, Chairman be authorized to sign.
Second.
Discussion?
How big are your caseloads?
Right. Case management, this case, the total, about 150 people total. The people are moving in and out of it. That's a complicated discussion. I'd be happy to have at any given time.
I'm sure it is, yeah. It's probably not today.
I did want to say, I wanted to thank Patty. We reviewed the contract, and certainly we're more than happy with what's in the contract. We feel we can do everything that's being asked of us and continue to provide good services. And also that you all know that the changes that are coming through right now in terms of case management, in terms of state payment for individuals being transferred to the county, and what that means for us as a provider. We need to make a lot of changes in our system. The county's having to make changes in its system, and we all don't know what's going to happen. I mean, quite frankly, with redesign and the regionalization. So it's a very difficult time for all of us. And I just want to commend Patty, and I'm not here to ingratiate myself. I'm too old to ingratiate myself. But, you know, Patty's worked very well with us in helping us manage how we're adapting to these changes, because they are extremely significant changes. Now, I've been doing this for 16 years now, and what we're facing over the next 2 years are changes we never would have imagined to happen. Hopefully, it'll work for the best. Hopefully. But we'll work with the county to try to make it work for everybody, especially the patients.
So what does this veto mean of the, that governor did on reorganization, regionalization? What, is that all in limbo yet, or is all the work that we've done is for not now, or?
Oh, no,
what is it?
he vetoed the transition funds, what they referred to as the transition funds.
That was about 16 million, or?
It was like $13
$13
million, yeah. And basically that was to go into what had previously been called the risk pool fund for counties that, and it was set there for counties that they didn't think were going to be able to financially provide the core services, okay? Woodbury County historically has never applied for those monies. And we wouldn't have been eligible to apply for them this time because the programs that we had in jeopardy here were Core Plus services.
Right.
So those funds couldn't be used for Core Plus services. They could only be used for core services. So we were locked out of that again as well. The terminology has kind of changed between what was once called the risk pool is now called the transition, and then you have the equalization funds, which there's a whole another round of rules and definitions that's going to come on that that we're trying to be on top of. And we had a statewide conference call with DHS last Friday, and some of those, again, there was more questions than there were answers on how they're going to distribute those equalization dollars, when they're going to distribute them, what is going to be subject to the offset principles, that if the state says you owe them money, they're going to keep that money before they even give you the check. So there was quite a bit of conversation on how they determine that. And then going forward on those funds, you know, they're going to determine how much money they've saved Woodbury County. And if they determine that DHS, by taking over the Medicaid expansion, has saved Woodbury County $100,000, then Woodbury County has to write DHS a check for $80,000. So they're going to claim 80% of the savings to be sent back to DHS.
It's called the clawback position.
The claw.
They're going to take the money back.
Yeah.
that would have been a savings to the county, significant.
So instead of the county being able to utilize and continue to develop, whether you're in a region or a single county, to develop core plus services, they're taking that money back. So,
So their intent is what? I mean, how are they gonna use this money?
You're asking the two wrong people, I think.
Well,
their statement was they wanted the taxpayers to benefit from the savings because of the Medicaid expansion.
well,
So
that's,
they're just
you know, that's
limiting what's
debatable.
done for the
I mean,
disabled.
if the money's left in the local community, and we're spending it on services for people in the community that needs it, then the taxpayer is gonna benefit from it. But how is it gonna benefit the taxpayer if we pay them back the money that they owe us in the first place?
Mhm.
The only other thing
That
that
kind of
veto,
services. That's
yeah.
Yeah, that's what it
all it
means.
boils down to.
Yeah.
The other part of the veto is he did veto expansion, or what's called the Home Community-Based Waiver Program.
Yes.
There are about 1,000 people right now in the state of Iowa that are on a waiting list that could come into services. Why he chose to veto that with the surplus the state has right now is really beyond understanding in my opinion.
That-
Makes no sense.
That was just,
We do not
Hard to
have
take.
that in Woodbury County.
Pardon?
We do not have a waiting list.
no, we do
No,
not.
this is for,
The waiting list that they wiped out was, the state has assumed those costs for the non-federal share of, waiver services. So the state would have been subjected to paying these non-federal share, and they just wiped that program. They had dedicated money, the legislature had dedicated money to allow those waiting lists to be completely depleted and everyone to receive services, and the governor chose to eliminate that. That was devastating to a lot of families.
a lot of people with brain injuries, a lot of people with disabilities.
So those people will no longer get the service.
They never got to get
They won't get
services.
off the waiting list,
Yeah.
the statewide waiting list.
So
A lot
they'll
of
be on the
people-
waiting list longer
Mhm.
and not receive any services.
Yeah, because the Medicaid expansion won't even start technically until January 1.
So it's a challenge for that. It's a challenging time, but I think if we keep focused on what we've always been focused on, what best serves the people that are in need in this community for mental health care, we'll do okay.
Yeah.
We will. I'm confident.
And,
We get our left ear burning from the state, and our right ear is like, okay, how are we going to make it work for us here? And we've done that, because we work well together.
Good. Okay.
All those in favor?
Aye.
Opposed? Motion carries. Now, recommendations.
Recommendation, what I would like to proceed on is with mental health fund balances, we've worked with Denny Butler on determining what those will be. And what I would like to do is have contracts back on the agenda next week for the continuation of the mental health court and for funding at some level that Jim and I will work on for the Friendship House to guarantee both of those programs continue for another full year. So I think we can comfortably do that. We won't be a part of the region until July 1, 2014. So those funds and those programs are historically what we have had here. We know the value of them. We know the services they provide to folks and the good they do. So we would like to continue them, and I would like to get those contracts ready to go for next week.
Okay. That's great. That's good.
So I can proceed on doing that and
Yes.
placing it on the agenda?
Please.
Okay.
Yeah.
Okay. So, and that feels good to be able to say that, so,
Yes, that's good news.
yeah.
And it's a relief for the people who go to Friendship House and for all our services. As I said, we'll find a way. It's not going to be easy, and it may get much harder next year.
Relatively speaking, though, I think that Friendship House is a low-cost
Yes, it will be.
diversion that more services being needed. I mean,
Well,
it's-
and I think sometimes we know things work because we know the people that it affects. We know them directly. But we probably need to do a better job ourselves of coming up with some kind of numbers that we can show a business-oriented type medical system, which this is converting over to. So we need to come to some way to grab those numbers and say, we reduce hospitalizations by this, we reduce medications by this, we prevent, these children and their families from going into further, into the juvenile justice or the mental health system, we need to come up with a way to do that.
But that takes time, and it takes someone dedicated to put a system together like that, to record that information.
But anything we can do to generate and show what our programs, what our Core Plus services accomplish, I think we need to do that.
We will need to do it to get funding in the future.
You may need to go individual client by individual client and say, how has this changed your life? And so we really start to, extrapolate from that, not only the cost savings, but the actual, quality of life issues involved. Families staying together, people going back to work, all those things.
The human side of the story, that oftentimes gets lost in
Mhm.
the numbers, which you need, but people can relate to the human stories that we can all tell when we're out and about and
We need to describe our successes better than we have.
Yeah,
That's what we need to do.
Because if you don't, nobody else is gonna do it for us.
Well, and I think there's, again, we covered it a little bit last week, but we need to contact out at the federal level and say, these are the programs we have, what do you want to see, even at the federal level, to include this in, the congressional
Yeah, and in fact,
record.
you do what you just said earlier, you initiate the information to them.
Mhm.
This is what it's accomplished in this community. Here's how we kept these citizens productive. We kept them out of this, we kept them out of that, and without it, they would be involved in the system and cause us more money. Because the federal system may not even know what information they want from us.
No. Whenever you produce some numbers, there's gonna be somebody sitting there saying, but what about this? And that's fine.
Mhm. That's right.
You start and you build from there, so,
Absolutely. So I think it's
that's
better
what
for
we
us
can do,
to define ourselves rather than
Yep.
someone else do the work for us.
yeah.
it's usually always better to do that.
That's right. That's right.
So I'll get them prepared and have them before you for next week, then.
Okay.
Okay?
Thank you much.
Thank you much.
One break, no, jail numbers are down, thank you.
And let's hope they stay down over the Saturday part over too long.
Yeah, we'll take a look at it next.
That's right.
For the agenda, hearing of any individual or group that wishes to make a presentation. James.
Good morning. Not a presentation, just a question.
You need name and address for
Jim Marshall, 4201 Denise Court, Apartment 419, Sioux City, Iowa. I would like to ask the board, I understand that any action taken has to be on the agenda, as an agenda item. And I would urge the board to put this off-duty work on the agenda to be voted on. I understand the concerns that you've had. The sheriff and the deputies union has also. They've addressed your concerns. They've offered solutions to them, and I think are probably pretty good solutions. And I would just urge you to settle this issue to one way or another. Voted up or down.
There's nothing to be voted on, Jim. We need a clarification on whose responsibility and authority that falls under. And until we get that, there's nothing really to do.
So this just lingers on with these people not knowing, they're in limbo, not knowing what's going to happen, how it's going to be handled. Is that what you're telling me?
They're on with what they think is right.
The sheriff
They're not
is
in
doing what
limbo.
he thinks he should do.
Is that true?
Yes, yeah, we're continuing.
Okay, then I guess I was out of line. I was under the assumption that there would be a vote taken on this issue, and
Not till we have clarification,
Not sure we have clarification.
and that is pursued.
now, is this pursuant to a suit, or is this just clarification of the issue?
No, this should resolve the issue.
And we've asked the Attorney General for an opinion, is that it?
We're not there yet, we're getting there.
Where does it lie right now?
It lies with us in the question that's going to be asked,
Okay, it lies with you, and the question is gonna be asked, who are you gonna ask?
We're gonna ask the Attorney General.
Okay, and when might this take place?
We can't ask, we can't ask directly.
Right.
I mean, we have to work for our county attorney to do that.
So when might this take place?
When you're dealing with attorneys, your guess is as good as mine.
Well, the attorney, if you're dealing with the county attorney, I'm sure he works for you, and if you could put that on his
No,
agenda.
it's not working
It
for
doesn't
us.
work for us.
The sheriff doesn't work for us.
I realize that. I realize that. But, you know, he represents the county. And if he can't handle an issue for you, get it resolved in a reasonable amount of time.
In the county too, Jim, and we have to take the proper amount of time to get the correct answer. We'll take it a step at a time.
And to see if something can be resolved before then. Maybe.
Well, how do you handle it if something can be resolved before then? What do you do? How do you handle it? You say, okay, go ahead and do what you're doing, or go ahead and do what we've discussed and brought up, or is that how you do that?
We have
I don't
to.
think that's fair.
So,
Your questions are not for us, your questions are for the sheriff.
well, no, I guess
The
my,
sheriff is proceeding under what he perceives as his duties and his right.
that's right. I understand that.
And we are questioning that, and we will get that resolved.
I understand that. But Jackie just made a statement that it could be resolved before that. If not prior to not getting an opinion.
I mean, there's always room for discussion if it's initiated by one party or the other. I think where I personally am at, I'm going to speak for even this board, is that we have had discussions. We passed a policy 2 years ago, a
Mhm.
lot of input, and I think it's the correct policy for our taxpayers in the best interest of our citizens. And we did throw out a compromise, I'm not sure exactly where that is, as far as maybe running the contracts through the county. I'm not sure if that's even legal, there seems to be.
I believe
some
Mr. Gill
question
addressed that
of
last
wage
week.
hour and-
I believe Mr. Gill addressed that last week, and it is legal.
It is?
Yes. Is that not right, Pat?
That's correct.
Well, there's more questions to that,
Yeah,
and
I mean,
there's
it's
other.
like-
issues.
Well, excuse me, so you got the issue of the vehicle,
It's not-
the uniform, and the
There's other
pay.
issues that has to be answered,
Yeah, you got, are those the three major issues, the vehicle, the uniform, and the pay?
Jim. There's-
Or are you talking about the authority of the
There's far
sheriff?
more than that needs to be answered. We need to have the right question answered.
It gets down to who is the sheriff's deputy's employer. We contend the board is, the sheriff contends that he is. Now that's as easy as it gets.
Yeah, I guess I'm just a simple, stupid guy.
No, there's.
I've negotiated contracts for over 30 years, and I found that resolutions are found in compromises, and compromises are made by people sitting down and discussing the issues, and where both people come out feel like they have
And when.
something out of it.
And I've negotiated contracts longer than that. And when you can't come to a compromise, there's such a thing as strike lockouts and everything else. And in the public sector, you don't have that.
No, you don't.
So you either get it negotiated, or you get it Attorney General's opinion, or you go to court.
Kind of like going to arbitration, we may just have to send it to somebody else to decide it.
To me, it's just sad that it can't be settled right here.
I agree.
Sadly, we've got to this point, I agree.
Is there anyone else wish to hear? Dave, did you have anything?
What's that?
Did you have anything you wanted to address more on?
No, our numbers are actually about the same as they were late last week. Today they went up a little bit.
Well, anytime they fall below 190, that's good news.
Yeah.
And what we're showing is just one day at 190, so. Is there anyone else? We're adjourned.
Move to adjourn.